Dr. Christopher Labos joins me every Sunday morning at 8:10 for the Sunday Morning House Call, and he's on the phone for a chat this afternoon. Hi, Chris.
Hi. Wait, that week really flew by. I can't believe it's the weekend already. That is incredible.
We're just messing with you. Chris, you have an article that I just read online on the Gazette site, and is this going to appear in, I guess, tomorrow's edition, I think, right?
It's going to appear in the print edition tomorrow, absolutely.
And you take a look at something that we touched on over the weekend. It's making the rounds online that maybe, just maybe, consuming honey can be a cure for seasonal allergies. And so you looked into this.
And no, it can't. It can't. I mean, the idea on which this is based is really stemming from this idea of immunotherapy. So if you're allergic to, let's say, peanuts, for example, there is a way to stop being allergic to peanuts, and that is to get a treatment of the peanut protein that most people are allergic to, and to give it to somebody in small doses over an extended period of time so that your body becomes used to it, and you sort of train your immune system not to see it as a foreign substance, because that's what an allergy is. An allergy is your immune system trying to mount an immune response against something that is actually benign. And so when you get the anaphylaxis or any of the allergic reactions that you get, this is essentially an immune reaction. So if you can train your immune system not to react that way, you can then consume something like peanuts without risk. And so that is immunotherapy. And so this whole idea of consuming honey seems to be derived from that. The idea being that bees are out there flying around collecting nectar from flowers. The pollen sticks to their legs. It gets incorporated into the honey. Ergo, if you eat the honey, you're going to be consuming a certain amount of that pollen, and therefore you won't get the same seasonal allergies.
Mm-hmm.
The problem with that theory is that the flowers that bees use to make honey is probably not what you are allergic to. Most people who are allergic to a specific seasonal pollen, that's usually something different. Most people are allergic to ragweed. If you have allergies in the fall, if it's in the spring, it's usually like tree or grass allergies. It's not the stuff that bees are using to make honey. So the pollen that's in honey is going to be very different than the pollen that you're actually allergic to. The other problem with this theory is that for immunotherapy to work, you have to take it, in a regular, sustained fashion over a long period of time. So you would have, even if this did work, you would have to eat honey, and the same honey every day for months, if not years, and that's not going to go well for you. I mean, it didn't go well for Winnie the Pooh, and it's not going to go well for you either if you start having honey on a daily basis.
Chris, I noticed you also brought up the example of aspirin allergies, right, in your piece. Tell me a bit about that.
So, I mean, this happens occasionally. It's happened to me, more than a few times, where somebody has an aspirin allergy, and so you question them. It turns out, yes, it's a true aspirin allergy. That does happen. You can become desensitized to aspirin. So usually what happens is you refer somebody to an allergist because you want this to be done in a controlled environment. And it's the same basic principle. You're basically giving them small doses of aspirin. So you start off by giving them a microscopic dose, 0.1 milligrams. And then you give them a higher dose, 1 milligram. And then you go to 2 milligrams. And you go to 5. And then you go to 10. And then 20, 40, 80. So you get them up to what the regular dose would be. And the idea of giving them these small but escalating doses, again, it conditions the immune system not to mount an allergic response. So you can get somebody's immune system used to the idea of taking 80 milligrams of aspirin, and then you can give them that dose without fear of them having, without their throat closing up or going into anaphylaxis. But the problem is that if you ever interrupt aspirin for whatever reason, say the patient needs to have surgery, well, now you need to start the process again. So there are ways to deal with allergies, whether they be seasonal allergies, food allergies, or medication allergies, but it can be a little bit complex. Eating honey is just not going to do it for all the reasons we've mentioned.
And as you mentioned in the article too, Chris, I mean, in this day and age of social media and anyone can put anything online, this all started with apparently a report out of Malaysia that they had proof that the honey was working. But I mean, when you dig a little deeper, that's not the case.
Well, no, and what's funny is that there isn't a lot of scientific data on this. There aren't many papers on this issue, but then you read the papers that are published, and they sort of the headlines are, "Oh, it works." Then you look at the statistics, and you're like, "Oh, no, it doesn't." I mean, it's almost these are very, very substandard papers. The one major one, the one that keeps coming up if you Google this, purports to be a positive study, and yet it's not. When you looked at the honey versus placebo group, the improvement in allergy symptoms was the same. So there's really no evidence to sort of back this up. And listen, you can enjoy honey if you want. It's not going to help treat seasonal allergies.
What do you tell patients when they want a little advice about trying to get through this miserable season that they deal with all the time?
Well, the allergies, seasonal allergies, are not in and of themselves dangerous. So if you can control them with over-the-counter symptoms, with over-the-counter medications, then so much the better. The older generation antihistamines caused a lot of drowsiness, and that's not dangerous per se, but it's dangerous if somebody's going to be driving a car, let's say, and might nut off. So there's been a gradual moving away from some of the older antihistamines to the newer generation stuff, which is not drowsy. They are the non-drowsy version. So if you can get away with just taking that, then you're fine. If your symptoms persist despite these medications, that's when you might need to see an allergist to look at, can there be some specific treatment? The other thing, too, is going to be identify exactly what you are allergic to, and that's where you have to go through allergy testing, where you get all those injections on your arm to see what exactly is it, which particular pollen is it that's causing your symptoms, and then you can look to see, can you do some source control around your home, or what are the options that are available?
Dr. Labos, can you develop allergies later in life? I mean, having avoided them all this time and then finally come down with something?
If in fact it's usually the opposite. It's usually people have allergies when they're young that resolve as they get older. It's very, very unusual for somebody to develop an allergy later in life. What usually happens is somebody moves and they go to an area and now they're exposed to something that they were never exposed to before. So they were, let's say, always allergic to this particular tree pollen. It's just that there were no trees in their area. So somebody who's allergic to ragweed but has never lived in Montreal, let's say, somebody moves to Montreal, is now exposed to all this ragweed that we have in the fall. So it's usually a change in circumstance rather than a change in biology. Like somebody will never realize they were allergic to cats, and all of a sudden, they get a cat in the family, and now their allergy symptoms develop. So it's not you develop an allergy, it's that you were exposed to something that you were never exposed to before.
Chris, over the last 3 years, you've debunked a lot of things that have popped up online concerning the pandemic, and Dr. Joe Schwartz is joining us in a few minutes, and apparently the latest one is that the reason why some people are suffering from long COVID is that because they were wearing a mask while exercising.
No, I mean, and I remember right at the beginning, I was running outside with a mask, which in retrospect probably wasn't necessary, but somebody said to me, he's like, you shouldn't do that. Your lungs might explode if you exercise when you're wearing a mask. And I was like, no, I'm pretty sure that's not true. I mean, long COVID really is the consequence of a viral infection. It is a long-term inflammatory problem, as near as we can tell. It is not all that dissimilar from some of the long-term complications we see after other viral infections. It's just more common and more long-lasting than we've seen before. The symptoms do tend to resolve with time, but it takes months. And I think that's what a lot of people don't realize, is that the recovery from COVID can take months, and some of the symptoms, like the loss of sense of smell, can persist for over a year afterwards.
Cardiologist with a degree in epidemiology and a regular on Weekends with Ken. We'll talk to you Sunday, Chris.
All right, talk to you then.